So, you've just been diagnosed with age-related macular degeneration. You're probably asking yourself, what does that even mean? How do I treat it? Well, don't worry. I'm here to answer all your questions. My name is Luke, and in today's presentation, I will be discussing whether microcurrent electrotherapy is an effective option in treating age-related macular degeneration. First, it's important to understand what you've just been diagnosed with. Age-related macular degeneration, or AMD, is a progressive disease that affects the macula, the part of your retina responsible for your sharp central vision. It is the leading cause of blindness in adults over 50 worldwide. As AMD progresses, everyday tasks such as reading, driving, and even recognizing faces can become difficult. And because our population is aging, the number of people affected continues to grow, making AMD a major public health concern. So, what does AMD even look like? For many patients, AMD begins subtly. You might notice blurred central vision, distortion of straight lines, or dark or empty patches in the center of your sight. At this stage, it's also important to understand the two forms of AMD: dry AMD, which is the most common and progresses slowly, and wet AMD, which is less common but more severe and can cause sudden changes in vision. Now, how does AMD develop? AMD develops due to a combination of aging, oxidative stress, and genetics. It primarily damages the photoreceptors and the retinal pigment epithelium, both of which are crucial for vision function. The disease progresses through early, intermediate, and late stages, and many people don't notice major changes until the later stage. So, what happens during late-stage AMD? In late-stage dry AMD, the buildup of drusen, which are small, yellow deposits of fatty protein that accumulate under the retina, and the breakdown of retinal cells can lead to geographic atrophy, where patches of tissue stop functioning. In wet AMD, abnormal blood vessels grow under the retina, leak fluid or blood, and can cause retinal scarring, which severely impairs photoreceptors. Both forms can significantly damage central vision. How is AMD currently treated? For wet AMD, the most common treatment is anti-VEGF injections, which are administered directly into the vitreous humor of the eye and work to slow blood vessel growth and fluid leakage. For dry AMD, treatment options are limited. AREDS2 supplements can slow progression, and newer complement inhibitor injections for geographic atrophy may help some patients, but not all, and they may even cause side effects. An emerging treatment alternative. One emerging option being explored is microcurrent electrotherapy. This treatment uses very low-intensity electrical stimulation applied gently through closed eyelids. The goal is to boost retinal metabolism, increase energy production in cells, and reduce inflammation, all of which are important in AMD. So, how can electrotherapy support patients? Research suggests this type of stimulation may help protect retinal cells, reduce oxidative stress, and improve the neural response of the eye. Early studies also show improvements in visual function, especially in patients with dry AMD. Results and efficacy. In early research, the results of microcurrent electrotherapy have been very encouraging. One of the first clinical studies found that in dry AMD, 56% of treated eyes showed meaningful improvement in visual acuity, while 40% remained stable. In wet AMD, 83% of eyes improved, with no decline seen. These results suggest that microcurrent electrotherapy may offer real physiological benefits, not just placebo effects. For patients with dry AMD, who often have the fewest treatment options, this could provide a non-invasive way to support their vision and maintain independence. Key takeaways for patients. In summary, microcurrent electrotherapy is a promising emerging treatment that may improve vision and slow progression, especially for dry AMD. But more research is needed before it becomes a standard therapy.